Hey, I just want to talk a little bit about auricular trauma release and how important it is for your patients, for your clients. Because so many people, they're holding on to trauma and they don't know it. Even when they do know it, how do they get rid of it? They don't know. What I've said to people so many times is that, a lot of the trauma that happens in your life follows a bit of a pattern. And often that pattern is set by the first trauma, the earliest trauma. And how amazing would it be if we could find that earliest trauma, identify an emotional context to it, find some treatment points on the ear for it, and allow that patient, allow that client to really be able to release that trauma. How freeing that is for their life, not just for their emotional world, but also, any chronic condition is often held there, maintained by this trauma that's weighing them down like a luggage that's too heavy. The auricular trauma release is a 3-step process. And if you come to the webinar on Wednesday, July 31st at 10 a.m. Eastern Standard Time, I'm going to lay those 3 steps out for you so that you can actually take back to your clinic some valuable information. And if you're really interested in diving deeper into this method, which doesn't require to know a whole lot of auricular beforehand, then I would recommend that you register for one of our 2-day courses. That's if you really want to bring this medicine back to your clinic and really dive deep into it. Now, even just with what I'm going to tell you in the webinar, you'll be able to start getting a sense of how to use it. And there are going to be some living auricular protocols that I'm going to be offering in the webinar as a special gift. And when you come to the 2-day course, I'm going to be offering many more living auricular protocols that are going to allow you to really dig into several different conditions. And trauma is going to be the focus of all of those chronic conditions. So join me July 31st at 10 a.m. Eastern Standard Time. It's free. Register now.